Welcome back. You're watching SABC News Channel. This is The Agenda. I am Tsipiso Makwetla in for Desiree Chalke and Blaine Herman. As we continue with stories making headlines here in South Africa, Humanitarian aid organization Gift of the Givers says a group of 40 medical personnel will be part of the multidisciplinary medical team, which it will deploy in Touws River in the Karoo to provide medical assistance to the community. SABC News reporter Mariska Botha was there for that launch.
Welcome back in Touws River, where there is a hive of activity in the school hall of the local primary. I just must warn you, if you hear shouts in the back, please don't be alarmed. It is people visiting the dentist. We've seen quite a large group of people going through to the dentistry section right at the back of the hall there. But I must admit, there was a little girl of about 10 years old. She brought herself to the dentist. She sat down, she had the needle in the mouth and had her tooth pulled. She was very brave. Some of the adults, not so much. But other serious conditions also being investigated here. General health is being assessed. People are getting medications and referrals for other treatments. We went to the back a little bit earlier in one of the classrooms where they set up for physical therapy. And there was a lady there who received a brand new wheelchair, and she just wept when she received the wheelchair. And we chatted again to Dr. Imtiaz Suleiman, the founder of Gift of the Givers, who says some of these interventions are so small, but they can change a person's life. Anyone who's walked around with a toothache will know if there's nothing you can do about it, your life becomes miserable. And for many of the people we saw here today, it was exactly that. They came to pull a tooth, and that changed their lives. To speak to us a little bit about the conditions in Touws River, we have a community leader and one of the founders of Compassionate Hearts. It's a feeding scheme in the town of Touws River, Rashad Baker. Rashad, thank you very much for joining us this morning. We're back in your town again. First of all, just give us an overall picture of the conditions in Touws River.
What I can say to you, good afternoon everybody, or still morning, sorry, is that not a lot has changed in this town since the last time we were here. What has happened here is in changes that has taken place as a result of our interaction with Gift of the Givers, and that's why they're here today. A week ago we went to one of the primary schools with Gift of the Givers to distribute some stationery packs, and then we heard that there was a child that had a problem with a toothache, and we know the situation in our town. Here is not available, no dentist, no doctor available. It's only the two doctors at the clinic itself, and they come twice a week, and they mostly see to chronic patients. The dentist himself comes once a month, sometimes every second month, which means it's very bad for our children, especially our children, to suffer from toothache. And there's not much that the parents or the teachers can do when children start complaining. So they end up losing out on schoolwork because they are being sent home, because the schools is not equipped to deal with toothache and those things. Unfortunately, we live in a very poor area. Schools don't have sick bays. They can't afford it. They don't have the funds to set it up. And the clinic try their best with the limited services they have available. But the amount of people that require services in town are suffering. People have to wait over a year just to see a physiotherapist or have their eyes checked or even get an appointment at the hospital. You must be in dire need, or there must be a real emergency before you can actually help at the hospital if you have no appointment. Ambulance service is also not to the best of our knowledge. During the week, yes, we have some service. Over weekends, we have literally no service, because then they focus on other areas, and Touws River is unfortunately on the backside.
We heard from people here telling us that it takes sometimes 3 weeks to a month in order to see a doctor. Is that correct?
Yes, that can take up to 2 months before you could actually see a doctor. Because you first have to follow the protocol at the clinic, where you have to get an appointment just to see the sister. Then the sister will investigate, examine you, and from there they will determine whether it's actually a need to see a doctor or not. And that can take up to 2-3 months before you actually get to see a doctor. And most of our cases, people is dire. We have a lot of chronic patients that needs to see a doctor at least once a month. And for most of them, it unfortunately doesn't happen because of the limited services we have available. The fact that Gift of the Givers is here today is a blessing, okay? Because we have seen over 500 people already being seen by this team. The dentists, children, yes, they're crying, but their tooth are being extracted because tonight they can sleep better. adults as well. We have disabled people that doesn't have wheelchairs. We had one patient that managed to was blessed with a wheelchair today. Well, she's been waiting for over 2 years for a wheelchair. She's been utilizing a broken down one from the clinic to be able to move around. But as of today, she can actually move around on her own because she has a decent wheelchair to move with. And that is just one of the problems we have in our community. Our patients suffer, our people suffer, and it's mostly our old people, disabled people. Because the services that they need are not really readily available for them. We have broadcasters, that's a whole initiative and this whole intervention all over the surrounding areas, including to the farms. We're still waiting on some farm workers that must be arrived. Maybe the farmer first wants them to finish work before he brings them through. Luckily, the team has agreed to remain here all day to see to everybody's needs. So the farmers will be covered, our schools are being covered, and mostly our old people are being covered. We've also covered some of the people in the old age home that needed urgent attention. Fortunately, so far we haven't had to refer anybody to hospital yet. But that doesn't mean it can't happen later in the day. And the ambulance service has made this ambulance available. Arrangements has been made with the hospital to make sure that our people get seen to when they arrive there and not sit and wait there for 2-3 hours. Because that is what has happened with most of our people that do end up at the hospital. You sit half a day, sometimes up to a day before you actually get seen. That is even before your observations gets done. And I mean, that is not fair on our people. People is sick. People don't go to the hospital or the clinic unnecessary.
Rashad, last question. Gift of the Givers is here today to help. We heard the screams there now of somebody getting their tooth pulled. We warned the public not to get alarmed when they hear that. So people are getting services today, but it's also shining a spotlight on the issue of healthcare services in your town. What do you hope will come from this visit besides the immediate care that people got?
What I would love to see happening is that the ministers, the directorate that makes these decisions in terms of budgets, need to wake up and see that Touws River cannot cope on a budget that we allocated to Touws River. Our people is suffering as a result of them not making informed decisions. Because clearly these can't be informed decisions. Because you must ascertain yourself as to the situation before you can make a decision. We have times where people go to the local clinic, they get seen to, but then there isn't sufficient medication for them. And it takes 2 to 3 weeks before they get the outstanding medication, and people has died in the process as a result of that because they need the medication now, not next week or tomorrow. And that is one of the problems they really need to see to. The other thing is they need to bring in additional staff and have doctors here on a more permanent basis, because you have doctors that comes twice a week, and after that there's no doctors available. Then you are handed over to the nurses and they make decisions upon that. Weekends is also a big problem for us because there's no clinic, there's no private doctor here, there's no private dentist that you can go to. The only thing we have in this town is a pharmacy. But these prices is exorbitant. People can't afford these prices.
Thank you very much. That was Rashad Baker, one of the community leaders and one of the founders of Compassionate Hearts, a local feeding scheme in the area, telling us just about the horrible situation for the community of Touws River and saying that he hopes the budget is coming up next week. They hope there will be better allocations for health and for towns like Touws River to perhaps get more personnel on a more regular basis, see doctors, because I can tell you there are hundreds and hundreds of people sitting outside waiting to get a turn to come in, people patiently waiting. It's very hot here, it's in the Karoo, and people are urgently wanting and needing healthcare. And it's not just the elderly that came. We saw mothers bringing little children, and we see young people in the queues here as well. So it's literally the entire town that is grabbing this opportunity with both hands to get some much needed basic healthcare services. And just to show you quickly how it works after people have been seen here, to the right hand side, this is where there's a dedicated dispensary, like a pharmacy in fact, where people are also given medications. We've heard people getting antibiotics, asthma pumps, and Disprins and the like. So they're getting all kinds of treatments here. It's not just they see someone and there's a referral card and that's it. They're also getting services including medicines today. But with that, it's back to you in the studio as the work continues here in Touws River.